Good day, presenting to you with a case of PPH, or known as postpartum hemorrhage. Before we proceed to the introduction, we will tackle first what are expectations of this case study. Expectation from case study. Through research and critical thinking, the following expectation can be achieved based from the case study. First, the student should be able to identify the signs and symptoms as well as the nursing management intended for postpartum hemorrhage. Second, the student should be able to identify causes and risk factors of postpartum hemorrhage. Third, the student should be informed and shall provide specific treatment based on diagnosis. Fourth, the student should be able to identify the pathophysiology of postpartum hemorrhage. And lastly, the student should be knowledgeable to formulate nursing care plan that will effectively provide quality care to the patient. Introduction of condition, disease. Postpartum hemorrhage, also known as PPH, is when a woman has heavy bleeding after giving birth, commonly defined as blood loss exceeding 500 ml after vaginal delivery and 100 ml after abdominal delivery. Once a baby is delivered, the uterus normally contracts and pushes the placenta. After the placenta is delivered, this contraction helps put pressure on the bleeding vessel in the area where the placenta was attached. If the uterus does not contract strongly enough, this blood vessel bleed freely. This is the most common causes of postpartum hemorrhage. If the small pieces of the placenta stay attached, bleeding is also likely. It most likely than other women to have PPH if it had it before. PPH can cause severe drop in blood pressure if not treated quickly. This can lead to shock and death. Shock is when the body
in order
organs
to officially
don't get enough
diagnose
blood flow. With postpartum hemorrhage or PPH, you have to have a blood loss of 500 ml for vaginal delivery and 1000 ml for C-section. So, PPH or postpartum hemorrhage is classified into two: the early PPH and the late PPH. Early PPH happens first 24 hours. So the 24 hours after the delivery. Then lastly, the late PPH happen anytime from 24 hours to 6 weeks recovery period. So there is a long frame of late PPH. Objectives. General objectives. At the end of the study, the student should be able to apply the correct procedures based on facts regarding diseases process, provide accurate information, passes composed attitude and sound judgment in rendering holistic care to the patient, and conduct true assessment by following the right procedure. Specific objectives. At the end of the study, the student shall be knowledgeable on the cause, risk factor, sign and symptom through research laboratory investigation, create or conclude specific treatment based on diagnosis, perform preventive measures, and manage postpartum hemorrhage during the urge of emergency. Scenario 1. A 39-year-old woman named TLC, married and a resident of Barangay Minawag, Dipolog City, is on her second pregnancy and delivered twin son 2 hours ago. There were no significant antenatal complications. She was prescribed ferrous sulfate and folic acid during the pregnancy as anemia, prophylaxis, and her last hemoglobin was 10.9 GDL at 38 weeks. The fetuses were within normal range for growth and liquor volume on serial scan insemination. A vaginal delivery was planned and she went into spontaneous labor at 38 weeks and 4 days. Due to declaration in the cardiography or CTG for the first twin, both babies were delivered by ventos after 2 hours of active pushing in the second stage. The midwife recorded both placenta as appearing complete. As this twin pregnancy, as intravenous cannula had been inserted when labor was established and epidural has been cited. The Lucia has been heavy since delivery, but the woman is now bleeding very heavily and passing large clots of blood. On arrival in the room, you find that the sheets are soaked with blood and there is also approximately 500 ml of blood clots in a kidney dish on the bed. Examination. The woman is conscious but drowsy, pale and complaining of pain on the incision site. The temperature is 35.9, blood pressure 120/70, and her rate is 112. The uterus is palpable to the umbilicus and feels soft. The abdomen is otherwise soft and tender. On vagina inspection, there is second-degree tear which has been sutured, but you are unable to assess further due to the presence of profuse bleeding. The midwife sent blood tests 30 minutes ago because she was concerned about the blood loss of the time and go for the following result. The physician ordered the following after examining the patient and blood test result. Winger lactate 1 liter with 10 units oxytocin to run for 8 hours. Transfuse 1 unit of PRBC 500 ml after properly screen and cross-match tranexamic acid 1 g IV stat. Give 500 UG agrometic IM now. 1 and OQC repeat CBC after 6 hour post-BT. Continue observation for bleeding. Attending physician, Dr. M.N. Gomez. Previous obstetric history. 2 years ago, she delivered her first child spontaneously to a healthy baby girl at 38 weeks with weight of 2.5 kg. At the nearest hospital, this child is currently living. She had PPH during this pregnancy and was transfused with 2 units PRBC due to retained placenta. No history of miscarriage. Preterm pregnancy. Patient profile and history. Patient profile. Name, TLC. Age, 39 years old. Gender, female. Civil status, married. Address, Minawag, Dipolog City. Attending physician is Dr. M.N. Gomez. Source of history. No data provided. Reason for seeking care. TLC is ready for scheduled labor at 38 weeks and 4 days. Physical. The patient is conscious but drowsy and pale. Mental. No data provided. Emotional. The patient is complaining of pain and incision site. Sexual. No data provided. Social. Same with the sexual. No data provided. Menstrual history. No data provided. Pregnancy history. G1POAO. Patient had given birth to her first healthy baby girl 2 years ago at 38 weeks, weighing 2.5 kg. The child is currently living. She had PPH during this pregnancy and was transfused with 2 units PRBC due to retained placenta. No history of miscarriage or preterm pregnancy. Major illness or health problem. There's no data provided. Contraceptives history. There's no data provided. Current health status. The patient was bleeding very heavily and passing large clot of blood. When you go into her room after the delivery, you will find the sheets soaked with blood, and there is also approximately 500 ml of the blood clots in a kidney dish on the bed. Family history, no data provided. Normal development at particular stage, adulthood stage. Person at particular stage of patient, medical care contact stage.
Good day everyone. I am Shelane Tabasa from BSN 2D and I'm going to present the diagnostic and laboratory results of our case, which is the postpartum hemorrhage. Postpartum hemorrhage can be quite serious. However, quickly detecting the problems by the help of diagnostic and laboratory tests, and of course treating the cause of bleeding, can often lead to a full recovery. Diagnostic procedures are examinations that helps us to identify individual specific areas of weakness and strength in order to determine conditions, disease, and illness. It is used to check if the person's health is normal or not. For example, a lab can test a sample of your urine, blood, and body tissues to see if something is wrong. A diagnostic test like blood pressure testing can show if you have low or high blood pressure. So how is postpartum hemorrhage diagnosed? Well, your healthcare provider will review your health history and do physical exams. Lab tests often help with the diagnosis. Other tests may include estimation of how much blood you have lost, measuring pulse and blood pressure, red blood cells count, and clotting factors in the blood. So we have 3 diagnostic and laboratory procedures that are necessary in our case, which is postpartum hemorrhage. First is the transvaginal ultrasound. This is used to identify the source of abnormal bleeding. Since that normal value and the result is not given, our interpretation in the case of our patient is that there is bleeding in the uterus. Bleeding in the uterus or losing lots of blood quickly can cause a severe drop in your blood pressure. It may lead to shock and death if not treated. Second is cross-matching test, which is very necessary in our case because our patient is losing a lot of blood, and it is also used to detect the presence of antibodies in the recipient against the red blood cells of the donor. These antibodies attach to the red blood cells of the donor after transfusion. An incompatible transfusion can result in a severe hemolytic anemia and even death. Since there is no data provided in our normal values and results for cross-matching, so I will just discuss to you the implication. If you have type A blood, you should only receive types A or O blood. If you have type B blood, you should only receive types B or O. If you have type AB blood, you can receive types A, B, AB, or O blood. If you have type AB blood, you're known as universal recipient. If you have type O blood, you should only receive types O blood. If you have type O blood, you're known as universal donor, as anyone can receive type O blood. Type O is often used in emergencies when there isn't enough time to perform blood typing tests. Lastly is our complete blood count. It is a group of tests that evaluate the cells that circulate in blood, including red blood cells, white blood cells, and platelets. The CBC evaluates your overall health and detect a variety of diseases and conditions such as infections, anemia, and leukemia. It is a group of tests that evaluate the cells that circulate in blood, including red blood cells, white blood cells, and platelets. The CBC evaluates your overall health and detect a variety of diseases and conditions such as infections, anemia, and leukemia. The result for complete blood count test or CBC are all given in a scenario. First, we have hemoglobin. The normal value for hemoglobin is 11 to 14 grams per deciliter. The result is 7.2 grams per deciliter. Interpretation is low, and implication, low hemoglobin values may indicate blood loss. So the results for our complete blood count test are all given in a scenario. First, we have hemoglobin. The normal values for hemoglobin is 11 to 14 grams per deciliter. The result is 7.2 grams per deciliter. And interpretation is low, and implication, low hemoglobin values may indicate blood loss. Next is platelet count. The normal values for platelet count is 150,400 times 10 raised to the power of 9 per liter. The result is 131 times 10 raised to the power of 9 per liter. The interpretation is low, and the implication, low platelet count may indicate bleeding is more serious because the body can form clots that will prevent serious bleeding. So, platelet count is necessary for clotting and control of bleeding. So, platelet count is necessary for clotting and control of bleeding. Next, we have white cell count. The normal value for white cell count is 6 to 16 times 10 raised to the power of 9 per liter. The result is 3.2 times 10 raised to the power of 9 per liter. Interpretation is low. Implication, low white cells increase the risk of developing a potentially life-threatening infection. White blood cells are produced by your bone marrow to help your body fight infection. Mean cell volume. The normal value for mean cell volume is 74.4 to 95.6 femtoliter. The result is 99.0 femtoliter. The interpretation is high. Implication: high MCV level means that the red blood cells are larger than usual and the patient has microcytic anemia. The normal values for international normalized ratio is 0.9 to 1.2. The result is 1.3. Interpretation is high. Implication: when the INR is higher than the recommended range, it means that the blood clots more slowly than desired. The normal value of activated partial thromboplastin time is 30 to 45 seconds. The result is 39 seconds. Interpretation is normal. Implication: normal value of APTT indicates that the body can appropriately form blood clots that helps to stop bleeding. APTT is used to measure how long it takes for blood to clot. Urea. The normal value for urea is 2.4 to 4.3 millimoles per liter. The result is 5.2 millimoles per liter. Interpretation is high. Implication: high levels of urea indicates dehydration. The normal value for sodium is 130 to 140 millimole per liter. The result is 138 millimole per liter. The interpretation is normal. Normal value of sodium will help maintain normal blood pressure and regulate body fluid balance. Potassium. The normal value for potassium is 3.3 to 4.1 millimole per liter. The result is 3.5 millimole per liter. The interpretation is normal. Normal value of potassium means that the body increases the release of a clotting factor that helps the blood to clot and regulate body fluid balance. Sodium levels are measured to detect whether there's the right balance of sodium and liquid in the blood to carry out functions. Potassium. The normal value for potassium is 3.3 to 4.1 millimole per liter. The result is 3.5 millimole per liter. The interpretation is normal. Normal value of potassium means that the body increases the release of a clotting factor that helps the blood to clot and regulate body fluid balance. Potassium is essential to regulating how the heart beats. Potassium levels that are too high or too low can increase the risk of abnormal heartbeat. Low potassium levels are also associated with muscle weakness and cramps. Creatinine. The normal value for creatinine is 34 to 82 millimoles per liter. The result is 64 millimoles per liter. The interpretation is normal. Since a patient is at risk for dehydration, creatinine should be monitored. High levels of creatinine indicates dehydration. The creatinine levels in the blood that are too high can indicate that the kidneys aren't working properly. The kidneys filter and excrete creatinine if they're not working as they should. Creatinine can build up in the bloodstream. Both dehydration and muscle damage also can raise creatinine levels.
Drug study of case scenario includes 3 drugs, which are the oxytocin, tranexamic, and ergometrin. First is oxytocin. Oxytocin is one of the most effective treatment for postpartum hemorrhage or PPH. The 2 main actions of oxytocin in the body are contraction of the womb or uterus during the childbirth. Oxytocin stimulates the uterine muscles to contract and also increases the production of prostaglandins, which increases the contractions further. In addition, manufactured oxytocin is often given to speed up delivery of the placenta and reduce the risk of heavy bleeding by contracting the uterus. Indication of this drug: induction of labor at term. Second, facilitation of threatened abortion. Threatened abortion, which is vaginal bleeding before 20 weeks gestational age in the setting of a positive urine and or blood pregnancy test with closed cervical. IM. Postpartum control of bleeding after expulsion of the placenta. Mechanism of action. Stimulates uterine smooth muscle, producing uterine contractions similar to those in spontaneous labor. Has vasopressor and antidiuretics effects. When we say vasopressors, these are medicine that constrict blood vessels, increasing blood pressure. They are used in the treatment of extremely low blood pressure, especially like this patient in this case scenario, Mrs. TLC, who extremely lost her blood. So the side effects and adverse reaction of oxytocin to the nervous system, maternal, coma and seizure, fetal intracranial hemorrhage. Side effects to the respiratory, fetal asphyxia and hypoxia. To the cardiovascular, maternal hypotension, fetal arrhythmias. F&E, maternal hypokalemia, hyperthermia, water intoxication. Side effects to the mist, maternal, increased uterine motility, painful contractions, abruptio placentae, decreased uterine blood flow, hypersensitivity, and hypersensitivity. The drug interactions is vasopressor. Again, vasopressor is to increase blood pressure in patients. So nursing considerations of oxytocin, it can cause ICH or intracerebral hemorrhage and asphyxia in fetus. And to the mother, it may cause coma and seizures, painful contractions, and may cause uterine tetany. So nurses consider to assess the fetus, assess contractions, monitor blood pressure, and assess the maternal electrolytes. Patient teaching is to advise the patient to expect contractions similar to menstrual cramps after administration has started. The second drug is tranexamic acid. Tranexamic acid is a medication used to treat or prevent excessive blood loss from major trauma, including the postpartum bleeding. Indication is to treat cyclic heavy menstrual bleeding and prevent hemorrhage. The mechanism of action is to displace plasminogen from surface of fibrin by binding the high affinity lysine site of plasminogen. That diminishes dissolution of hemostatic fibrin, which decreases the bleeding. The side effects and adverse reactions to the nervous system of this drug is cerebral thrombosis.
We will talking about pathophysiology and rationale. Normal anatomy and physiology of the female reproductive system. The female reproductive system is designed to produce an offspring with the overall health of organs and ovaries. The ovaries are small, oval-shaped glands that are located either the side of the uterus. Vagina. So the vagina is a canal that joins the cervix, the lower part of the uterus, to the outside of the body. And also vagina, also known as the birth canal. Then, we have the external genital organs. These include the mons pubis, labia majora, labia minora, and the clitoris. The area containing this organ is called vulva. And mammary glands simultaneously carrying out their individual tasks. So next we have the uterus. The uterus or womb is a pear-shaped hollow organ between the urinary bladder and rectum and is supported by the broad ligament, round ligament, and uteroscal ligament. The uterus function is to retain and nourish a fertilized egg. It's a wall consistent of 3 layers: premetrium, myometrium, and endometrium. The myometrium is responsible for immediate contraction right after delivery of prevent excessive bleeding. So the function of the uterus, or also called as a womb, is to nourish and house a fertilized egg until the fetus or offspring is ready to be delivered. Vagina is a thin-walled organ that serves as a passageway for menstrual flow and childbirth, and it's also the organ responsible for receiving penis during sexual intercourse. Even the tissue of the vagina are flexible and soft. With excessive force during delivery, they can tear, causing severe pain and bleeding.
Hello, I'm going to discuss about the concept map of the primary postpartum hemorrhage. So, introduction to the case. Primary postpartum hemorrhage is defined as the loss of more than 500 ml of blood in the first 24 hours following delivery. So, normally, after delivery of the baby and the placenta, the uterus immediately contract. This is to control bleeding, but here in the primary postpartum hemorrhage, there is an absence of contraction, so there is an excessive bleeding. In client's profile, the patient's name is Yamberger de Vries, age is 39 years old, gender is female, civil status is married, city is Binao Dipolg City, attending physician is Dr. M.N. Gomez. In her health history, under the history of present illness, the patient was admitted to the hospital for her second pregnancy labor. After 2 hours of active pushing, a ventouse was administered. After assisted delivery, the patient was excessively bleeding and is complaining of pain in the incision site. The patient also appears pale and drowsy. Past medical history, the patient was diagnosed by postpartum hemorrhage during her first pregnancy due to retained placenta. She has no past surgical history, and medication history is the patient was prescribed ferrous sulfate and folic acid during pregnancy. So, the predisposing factors or the risk factors manifested by the patient are anemia, age, multiple pregnancy, race, previous BPH, epidural, assisted delivery, prolonged labor. So anemia, since the patient has a low hemoglobin level, lower than 11 grams per deciliter. Anemia is a risk factor of postpartum hemorrhage because it impaired the contractility of the myometrial cell, which is responsible of the contraction in the uterus. Age is a risk factor because age higher than 35 years old has a higher risk of complication during labor and pregnancy. This is because the muscles of the uterus produces less energy, so there is a less effective contraction. Multiple pregnancies, and since our patient has a twin pregnancy, it overstretch the uterus, so the capability of the uterus to contract and retract is weakened. Race. According to the Maternal and Health Child Nursing book, Asian and Hispanic women has a higher risk of experiencing uterine atony, which is a leading cause of postpartum hemorrhage during labor. Since our patient is Asian, so previous BPH. So the patient is diagnosed by postpartum hemorrhage in her first pregnancy. So this increased her risk to have a postpartum hemorrhage in her second delivery. Epidural. According to some studies, epidural interfere with the major hormones of birth and labor, which then interfere to uterine contraction. So, assisted deliveries. Since our patient underwent an assisted delivery because of ventouse, because there is a decreased cardiograph in her one of her twins, so it is an assisted delivery. It is a risk factor because assisted delivery increase the risk of trauma, damage in the genital area, which causes bleeding, and increased risk of postpartum hemorrhage. Prolonged labor. So prolonged labor exhausts the myometrium, so contraction is weakened. So the precipitating factors or the causative factors are uterine atony and lower genital tract trauma. So uterine atony is the leading cause of postpartum hemorrhage. It is defined as relaxation of the uterus, so there is an absence of contraction in the uterus. So when this happens, the bleeding is continuous because there is no pressure to clamp shut the blood vessels that are connected in the uterine muscle. So now I'm going to discuss about the pathophysiology. So first, the patient had undergone a vaginal delivery of twins. So since it is twins, it overstretched the uterus. So it then led to uterine overdistension and tear laceration for birth. So in tear and laceration of birth, because of this, the patient manifested or complained about pain in the incision site. So back here in the uterine overdistension, since the uterus was overstretched because of multiple pregnancy, because she delivered twin. So what happens is in here is the myosin and the actin, which is responsible for the contraction of muscle, is pulled apart. So when they are pulled apart, they cannot overlap and connect to each other to allow contraction. So when this happens, there is a limit on contractile ability. So when this happens, it leads to inadequate contraction of the corpus uteri myometrial cell, or the cells that gives the uterus a contractile ability. So after there is an inadequate contraction of the corpus uteri myometrial cell, it leads to slow or absence of uterine contractions because kay na naman to siya kanang naglimit naman yung contractile ability, so dili na kay siya makakontract, so it leads to slow or absence of uterine contraction. So this absence of uterine contraction leads to vessels in the uterus don't clamp shut because the contractions help to control the bleeding. So when there are no contractions, so there is no pressure to clamp shut the blood vessels, so the bleeding is continuous. So there is then an excessive bleeding. So the tear and laceration from birth is also leads to excessive bleeding because there is a tear and laceration in the from birth. So since the vascularity of the tissues in that part has increased because of pregnancy, so if there are tear or laceration in there, it causes bleeding. So it is factor it causes excessive bleeding. So when there is an excessive bleeding, so the patient, so the blood loss. So the patient experienced blood loss of greater than 500 ml. So nag-blood loss na siya of greater than 5 ml. Morning nakakuan siya na feel niya kanang mga sign and symptoms ani kay ang 500 ml of blood clots plus sheets are soaked in the blood. Diba na naman to 500 ml in the kidney dish. So they nag-soak pa man siya sa napamay blood ang sheets niya kay na-soak pa man siya sa blood, so mas taas na siya sa 500 ml. Then there is a bleeding very heavily with passing large clots. So according to my research and according to the book that I read, Heavy leukia plus passing of clots indicate low contraction. So, low contraction, so excessive bleeding siya. So, excessive bleeding, nag-blood loss din siya o more than 500 ml. Next is increase in heart rate, which indicates blood loss. Dayon, peripheries feel cold because there is a kanang slow circulation of blood. So, bugnaw yung mga extremities. So, after the patient has lost blood of more than 500 ml, so niglead to siya og decrease in blood volume. So, nigamay iyang blood volume. The decrease in blood volume leads to decrease in renal perfusion o decrease in tissue perfusion. So, dili sa decrease in renal perfusion, so there is an decreased blood flow in the kidney. So, when makadetect na dayon ang kidney nga naay blood loss, so mag-renal perfusion. So, mag-activate na dayon ang RAAS system, which causes increased sodium retention by kidneys, which lead to reduced water loss into the uterine. So, increase in retention in fluid. Then this decreased retention of this decreased renal perfusion leads to oliguria. So, di ba nag-lead naman to siya oliguria. So, that's why in her diagnostic result, nag-increase iyang urea. So, here in the decrease in tissue perfusion, so there is a decrease of blood flow, low of production of oxygen and other nutrients that is important in cellular activities that mao nang nagmanifest or naka-feel og drowsiness og pale ang skin sa patient because of because of decreased tissue perfusion, and this leads to hemorrhagic shock. So may sign and symptoms ang atong patient like pain on the incision site. So, ang nursing diagnosis ana kay acute pain related to impaired tissue integrity. And the nursing interventions are inspect skin on a daily basis. This is to check if there is any improvement in the wound or there is a sign of infection. So, apply appropriate dressing to avoid infection or bacterial contamination. Discuss importance of early detection of skin changes, assess patients in understanding and following medical regimen, administer analgesic as a pain reliever to alleviate pain. So another sign and symptoms manifested by the patient is 500 ml of blood clots and sheets are soaked in blood, bleeding very heavily with passing large clots, increased heart rate, peripheries feel cold. So the nursing diagnosis is fluid volume deficit related to excessive bleeding. Nursing interventions are monitor vital signs. So you have a baseline data. Assess and record the type and amount of bleeding through monitoring perineal plots used in every hour and assess type of leukia. So, to know the amount of blood loss. Assess color, odor, consistency, and amount of vaginal bleeding. So, this give information to about the active bleeding. Elevate the lower extremities to improve circulation of blood. Perform fundal massage for the uterine contraction. Monitor input and output every shift. Offer a bedpan or assist the woman to the bathroom. Continue observation for bleeding. Administer ringer lactate 1 filter with 10 units oxytocin. Administer tranexamic acid and peroxygen by face mask. transfuse 1 unit of PCRB. So these are the pharmacologic intervention that helps in postpartum hemorrhage. So last in the signs and symptoms, drowsiness, pale skin, the nursing diagnosis is ineffective tissue perfusion related to hypovolemia. So the nursing interventions are maintain bed rest, then start or maintain an IV as prescribed. So to avoid dehydration, then insert Foley catheter and monitor your urine output hourly or as indicated. Then obtain and administer blood products as indicated.
Now, I am going to explain the disease process of postpartum hemorrhage and its effect on different organs or systems. So it all root down right after the patient's delivery, in which the uterus is supposed to begin a process called involution, which is the returning of the uterus to its pre-pregnancy state or original state, by contracting to compress blood vessels and also expels the placenta but failed to do so. Why? It's because the uterus became over distented or excessively large in size due to multiparity and multiple gestation. Also, having an epidural, which is a pain blocking medication that numbs the uterus and also decreases its ability to contract, it is now even more harder for the patient to deliver her twin sons. And with the prolonged labor, there decelerations in the first twin son's CTG occurred. That's when the ventus or the use of vacuum cup delivery took place. Due to the use of vacuum cup to deliver the twins, a second degree vaginal laceration occurred. So the failure of uterine contraction and second degree vaginal laceration resulted in uncontrollable bleeding, which is now we call postpartum hemorrhage. The two organs that are deeply linked with postpartum hemorrhage are the uterus and vagina, because failed uterine contractions and vaginal lacerations can lead to an uncontrollable bleeding. Also, the circulatory system is also affected due to its vast system that is composed of organs and blood vessels that acts as the delivery and waste removal system of the body. Classical signs and symptoms of postpartum hemorrhage include heavy and uncontrolled bleeding, pain, pale skin, drowsiness, increased heart rate, and boggy uterus. All of these classical signs and symptoms of postpartum hemorrhage are manifested by the patient. So, heavy and uncontrolled bleeding is caused by unconstricted blood vessels due to failure of uterine contraction. Pain on the incision site or lacerations are common in nulliparous and young women. Also, patients can also get lacerations when they have assisted delivery or episiotomy. Pale skin or anemia indicates that there is inadequate blood supply in the body. Drowsiness or sleepiness have common behaviors like open or closed eyes, fluttering eyelids, semi-dozing appearance, and slow, regular movements of the extremities. Increased heart rate results from reduced blood volume circulating the system. And boggy uterus indicates that the uterus is not contracting well, which increases the uterine bleeding.
So now we are in nursing care plan. So this is nursing care plan number 1. So in assessment, objective data, blood loss of approximately 500 ml, increased heart rate 112 beats per minute, and drowsiness. Our nursing diagnosis is excessive bleeding. Belongs to the taxonomy nutrition class 5 hydration, and our nursing diagnostic statement is that deficient fluid volume related to excessive blood loss after birth, as evidenced by loss of approximately 500 ml of blood in the first 24 hours following delivery. In our cause analysis is that if the uterus does not contract strongly enough, these blood vessels bleed freely and can cause hemorrhage because the blood vessels cannot constrict. So then in our planning, short-term objectives, our objective is after 4 hours of nursing intervention, the patient will manifest a decreasing amount of vaginal bleeding as evidenced by patient saturates one perineal pad for more than 1 hour. And our long-term objective is that after 48 hours of nursing intervention, the patient will manifest signs of optimal fluid volume as evidenced by stable vital signs and moist mucous membranes. So in our independent intervention, so there's one, monitor vital signs. This is to obtain baseline data. So this is to identify patients' progress throughout the hospitalization. Then assess and record the type of amount of bleeding through monitoring perineal pads used every hour, and also assess type of lochia. So this is the amount of blood loss will determine the appropriate fluid replacement of the patient. Then assess color, odor, consistency, and amount of vaginal bleeding. So this provides information about active bleeding versus old blood, tissue loss, and degree of blood loss. Then elevate the lower extremities. So this is to improve circulation to essential organs, since oxygen depleted organs in lower extremities have a hard time circulating since they are moving against the gravity. So lifting your lower extremities up could help you. Lifting your lower extremities will help your circulation. Then perform fundal massage. So this is to encourage contraction so that this could stop or lessen bleeding. Then monitor input and output every shift to prevent dehydration, fluid retention, and other problems related to fluid balance. Then next, offer a bedpan or assist the woman to the bathroom at least every 4 hours. This is to be sure that her bladder is empty, because full bladder predisposes a woman to uterine atony. Then continue observation for bleeding. This is a vital part of the information gained to ensure that safer patient care and early recognition of deterioration. So here, independent pharmacological intervention. So administer Ringer lactate 1 liter with 10 units of oxytocin to run for 8 hours, together with administer tranexamic acid 1 gram intravenous through tubing immediately, and administering 500 microgram of ergometrin intramuscular. Now, all these 3 medicines helps uterine contraction and decreases postpartum hemorrhage. These 3 was discussed in drug study. Then administer oxygen by face mask at a rate of about 10 to 12 liters per minute. This is to increase oxygen available for body uptake. Then transfuse 1 blood of PCRB 500 ml after properly screened and cross-matched. This is for the replacement of the blood loss. Then, collaborative review laboratory data, hemoglobin, hematocrit, electrolytes, total protein, albumin. This is to obtain baseline data. This is also to identify patients' progress during hospitalization. And in our evaluation, goals was met as evidenced by patients saturates one pad for 2 hours or equivalent to 50 to 80 ml. And in our long-term objective, goals was also met as evidenced by pulse rate and blood pressure under normal range, 76 beats per minute and 120/80. Moist mucous membranes, good skin turgor indicates good hydration. That's all.
Next in the NCP is the laceration from birth. Under the assessment column is the subjective and objective data. In the subjective data, the patient was complaining of pain on the incision site, and objective data of the diagnosis is a second-degree tear is observed on a vaginal inspection. So, in the nursing diagnosis, the problem states that there is a laceration from birth. The taxonomy of it is safety or protection class 2 physical injury. The nursing diagnostic statement of it states that impaired skin integrity related to tissue trauma secondary to vaginal birth as evidenced by feeling pain at the incision site. The cause analysis of it states that second-degree vaginal laceration occurred due to venous delivery. So, the reason laceration from birth is a problem is that there is a vaginal laceration occurred due to venous delivery and due to multiple gestation. Next is the planning. In the planning column, there is a short-term objectives and the long-term objectives. First, the short-term objectives. At the end of the shift, the patient will experience first, less pain on the incision site. Second, participate in prevention measures and treatment program. Next will be the long-term objectives. At the end of the shift, the patient will be able to first, report pain is relieved or controlled. Second, display timely healing of wound without complication. So next is the intervention. First of the independent intervention is inspect skin on daily basis, describing wound or lesions characteristics and changes observed, and the rationale of it is to determine if there is wound improvement. Second, in the independent intervention is apply appropriate dressing, and the rationale of it is for wound healing and to best meet the needs of the client in care setting, because dressing can help the wound to be healed perfectly and also helps the wounds cannot be contaminated. Third is discuss the importance of early detection of skin changes and or complications, and the rationale of it is enhances commitment to plan and optimizes outcome. Fourth, assist patient in understanding and following medical regimen and developing program of preventive care and daily maintenance. And the rationale of it is to maintain an acceptable level of pain. Notify the physician if the regimen is inadequate to meet pain control goals. Independent intervention, must be prescribed or ordered by the physician. First of the dependent intervention is administer analgesics as indicated to maximum dosage as needed. Lastly is the evaluation column. There is a short term and a long term. In the short term, at the end of the shift, the patient experience first, laser pain on the incision site. Second, followed and obeyed treatment program. In the long term, after discharge, the patient experiences lesser pain on the incision site. Lastly, the wound had a greater improvement. Next in the NCP is the decreased tissue perfusion. Under the assessment column is the subjective and objective data. In the subjective data, there is no data provided. And objective data of the diagnosis is the woman is conscious but drowsy and pale. So in the nursing diagnosis, the problem states that there is a decreased tissue perfusion. The taxonomy of it is activity arrest, class 4 cardiovascular pulmonary response. The nursing diagnostic statement of it states that ineffective tissue perfusion related to hypovolemia as evidenced by drowsiness and paleness. The cause analysis of it states that decreased tissue perfusion leads to paleness and drowsiness because of decreased blood flow. So the reason decreased tissue perfusion is the problem is that there is an irregular blood circulation that causes the patient in pale and drowsy state. Next is the planning column. The short-term objectives that at the end of the shift, the patient will experience first, no evidence of shock and vital signs are quite stable. Second, maintain bed rest and pursue diversional activity. The long-term objectives is that at the end of the shift, the patient will be able to show less evidence of pulmonary edema and urine output is adequate. Lastly, for the moment, it shows no sign of seizure activity. So next is the intervention. First of the independent intervention is the maintain bed rest. The rationale of it is that it decreases the metabolic demand because it helps the muscular tissue to relax. Second in the independent intervention is can do diversional activities while on bed rest. And the rationale of it is that it reports of pain management methods relieve pain in satisfactory level. Because of the diversional activities, the patient will feel comfortable and ease pain. In the dependent intervention, it must be prescribed or ordered by the physician. First of the dependent intervention is start or maintain an IV as prescribed. Use a large gauze catheter when starting the IV for blood and large quantities of fluid replacement. Second, insert Foley catheter and monitor urine output hourly as indicated. Third, obtain and administer blood products as indicated. So one of the rationale of the tissue perfusion is that sufficient fluid intake maintains adequate filling pressures and optimized cardiac output needed for tissue perfusion. So lastly is the evaluation column. The short term of it is at the end of the shift, the patient will experience first, normal sensation and movement as appropriate. Second, can identify factors that improve circulation. The long term of the evaluation is that after discharge, the patient maintains maximum tissue perfusion to vital organs as evidenced by warm and dry skin, present and strong peripheral pulses, vital signs, vitals within patient's normal range. Lastly, patient states when to contact physician or healthcare professionals.
Hi, I am April Jane L. Kizo, a BSN student of the Rizal Memorial State University main campus. Our case study is entitled Postpartum Hemorrhage, and my part is to tackle about the evaluation and recommendation following the evaluation and implication to nursing practice, nursing research, and nursing education. But before I proceed to my topic, I would like to give my brief explanation about postpartum hemorrhage. Anyway, when we hear the word postpartum hemorrhage, our understanding is most likely bleeding from the word hemorrhage, right? Well, you're right. Because PPH or postpartum hemorrhage is the heavy bleeding after the birth of your baby. Losing lots of blood quickly can cause a severe drop in your blood pressure, and it may lead to shock and death if not treated. And the most common cause of the postpartum hemorrhage is when the uterus does not contract enough after delivery. Although the postpartum hemorrhage is already discussed by the previous reporters a while ago, but what I'm explaining is all about my own understanding about the postpartum hemorrhage. Next, I would like to tackle about the prognosis of the patient. Upon further assessment of the patient, she is under monitoring and slowly recovering from blood loss. Patient who is diagnosed with postpartum hemorrhage is a dangerous condition because you can lose more blood. If not treated quickly, this can lead to death. And patient TLC who have had PPH are more likely to have one in the future. Luckily, proper administration of oxytocin intramuscularly and intravenously has improved patients' outcomes. The prognosis depends on the cause of the PPH or the postpartum hemorrhage, its duration, the amount of blood loss, comorbid conditions, and the effectiveness of treatment. And prompt diagnosis and treatment are essential to achieving the best outcome for any given patient. And most reproductive age women will do well if managed promptly in sitting with operative and blood product resources available. Consequences include the sequelae of hemorrhage, aggressive fluid resuscitation, blood product exposure, and procedure done to control uterine, cervical, vagina, or peritoneal hemorrhage. Next is the recommendation to promote early recovery and rehabilitation. Vital signs should be stable within normal range, and the patient with PPH requires aggressive measures to restore and maintain the circulating blood volume. And we have to ensure the blood loss is replaced and the bleeding would stop. And now we are down to discussing about the evaluation and implication to nursing practice, nursing education, and nursing research. First, I would like to discuss about the nursing practice. So nursing practice, this case study is carefully constructed in order to produce comprehensive information that can be used in dealing with the patients with postpartum hemorrhage and provide them with holistic nursing care that extends beyond administering medication and monitoring vital signs. And interventions and nursing management strategies were carried out through thorough planning of the formulated diagnosis from all the data gathered during the assessment of the patient. Nursing education is that postpartum hemorrhage can be a frightening experience for patients, and it is important to provide reassurance through constant communication in each step in emergency care. Make patients aware of what to anticipate through their clinical course, including expected procedures, transport, and the indication, risk, and benefits of intervention. Lastly, we have nursing research. So, postpartum hemorrhage is considered a dangerous condition as patients tend to lose more blood, which can possibly lead to death if not treated immediately. This case study presents the importance of having emergency care available if needed at the delivery after birth. Early care can reduce the amount of blood loss, and the patient was diagnosed with postpartum hemorrhage. Yes, postpartum hemorrhage, hence prompting the importance of knowing more about postpartum hemorrhage to prevent severe complications and abnormalities. So that's the end of our case study entitled Postpartum Hemorrhage, and on behalf of my fellow group mates, Group C, I would like to say thank you for reading and for understanding our case study, and I hope you like it and you understand it very well, and I hope our explanation is good, and please be merciful for asking question in the next following days. And I hope you understand well, ma'am. God bless. Thank you.